Pitch is presented by Knowledge Success and supported by USAID.
This is The Pitch, a continental competition looking for the next knowledge management innovation in family planning and reproductive health. From over 80 applications from around the world, 5 were chosen as semi-finalists from Asia. With just 5 minutes to deliver their pitches, they will be under great pressure to convince our judges to fund their innovations. A total of 2 winners will be selected as our KM Champion Innovators. Determining who will win an award of up to $50,000 US, let's meet our 6 expert judges. Rodeo Diallo is Interim Deputy Director, Optimized Family Planning Interventions, the Bill and Melinda Gates Foundation. Dr. Joanne Peter is a Director of Social Innovation at Johnson & Johnson. Mewita Budahasthana is a full professor of the Department of Biostatistics and Population, Faculty of Public Health, Universitas Indonesia. Kai Mutunga is a Senior Technical Advisor, Population, Environment, and Development at USAID. Dr. Tara Sullivan is the Project Director of Knowledge Success at the Johns Hopkins Center for Communication Programs. Anthony Daly is the Deputy Director of Family Health at the Bill and Melinda Gates Foundation. The stakes are high. Who has what it takes to be one of the next KM Champion Innovators? Hello, I'm your host, Lisa Moicambo from Knowledge Success. Before we meet our semifinalists, let's hear from the judges about what made them excited about this competition.
I'm excited to be on this panel because forever there have been difficulties in getting the right information to the right people when they need it. I'm really looking forward to hearing the innovative solutions to overcome many of these age-old problems.
I'm at the verge of very frustrating time because I've been in family planning for over 30 years and I see less and less family planning information access for women in Indonesia. So I'm so excited about what will be the result of this competition, that Indonesia can copy some of the innovation. I'm so desperate of getting something new in our family planning in this country, which has been stuck in the last 2 decades.
Thank you, judges. Now, let's get started with our first semifinalist.
I am Shafiqur Rahman. I am working for the Bangladesh Center for Communication Programs, BCCP, which is a Bangladeshi NGO. It is located in Dhaka, and I'm speaking from the capital city of the Bangladesh, Dhaka.
And this is Dr. Shahidul. I am working for Bangladesh Center for Communication Program, and I am from Bangladesh. Welcome, everyone. I will start by telling you a real life story about a Bangladeshi 16-year-old girl, Nasima, living in a remote village. She was married at 14 and within 2 years, she got pregnant and lost 2 babies. She then again became pregnant for the 3rd time at 16. Nasima represents the 59% of the young women of Bangladesh who become married before the age of 18 and 28% of those between the ages of 15 and 19 become pregnant. These statistics represent the real danger to the health of the young women and their ability to fulfill their dreams. Pregnancy and childbirth-related complications are the real cause of death among young women 15 to 19 years old, accounting 99% of the maternal death in low and middle-income countries. Adolescents face tremendous challenges meeting their research needs due to lack of knowledge and information regarding pregnancy, sexuality, which makes them susceptible to high rates of early pregnancy, STIs, sexual and gender-based violence, forced marriage, and high fertility. Bangladesh Center for Communication Program first ever introduced the Know Yourself multimedia campaign with adolescents and with USAID funding to encourage adolescents to seek more information and discuss about reproductive health.
To scale this information in a sustainable way that ensures that adolescents becomes reproductive health advocates and leaders, we plan to work with 300 adolescents club of the Ministry of Women and Child Affairs to train 600 adolescent leaders with life skill orientation package consist of modified version of the existing booklet series Know Yourself plus the entertaining comic book, and also make these resources available online and boosted through social media platforms. The trained leaders will in turn provide orientation to the rest of the 7,000 club members across Bangladesh. The club members will orient their peers to build life skills, connect them to health and family planning service delivery sites as well. To meet the expenses of this scalable innovation, we requesting US $49,895, and the bulk of the expenses will go to capacity strengthening workshop, meeting, and digitizing and printing of campaign materials along with travel and staff time. In addition to the orientation, the trained adolescent will be hooked up with the countrywide 903 gender-sensitive adolescent-friendly service centers being provided by the Director General Family Planning. They will act as co-facilitator with the service providers of the centers to encourage adolescents to come to the centers for advice and information. Thus, the intended adolescent will be well informed regarding family planning and reproductive health issues, have an intention and increased self-efficacy to become a family planning user, and be confident in their ability to advocate for adolescent and youth sexual and reproductive health. Sustainability be ensured through involving officials and service providers of Ministry of Women and Child Affairs and Director General of Family Planning. Nasima represents Bangladesh's adolescent population, which covers more than 1/5 of the total Bangladesh population. By funding this innovation, we will be creating an informed and empowered adolescent population that can proudly serve as knowledgeable advocates for AYSRH issues. Thank you.
Wow, great job. And now let's see if our judges have some questions.
What motivation structures will be used to make sure that the adolescents continue being engaged? Thank you.
Basically, the existing material, what I am terming it as the modified version, will be the basis, because those materials are already enriched with the different reproductive and family planning needs. But when they will be provided training at BCCP, there will be series of training. We have planned 600 adolescents to be trained on of 300 clubs. So these 600 people will be trained in 30 batches, what we have planned. And we are planning to engage another 7,000 adolescents with those groups, because these clubs having 25 members in each of the clubs. So they will be still having 23 rest members in their club. So when these 600 adolescents will go back to their clubs, they will have the opportunity to provide those information to the rest of the members. And in turn, they will also be act as the facilitator to their community to have those knowledge provided to their peers as well. And in the training, they will also be provided with other information and the reproductive and family planning information, because Bangladesh is passing very great challenge that they are really now having with a stagnant what you call plateaued level of the fertility. And we are experiencing that 2.3 total fertility rate are becoming stagnant for last 8 years. And the researchers have shown that only addressing to the adolescent can address to this problem of stagnancy in the plateau level of fertility, and we will be able to bring it down to 2. It is not possible as government has planned it by 2023, but probably within next 5-6 years, it will be possible if we can rightly address to the reproductive health and the family planning needs of the adolescent people.
A big round of applause for our first semi-finalists. Do they have what it takes to win? Keep watching.
Hi everyone from around the world. This is Shilpa from Nepal. I'm working as a program manager at Visible Impact, which is a youth-led organization working for the sexual and reproductive health and rights of young people. Knowledge management will never work until you realize it's not about how you capture the knowledge, but how you create and leverage it. In Nepal, although there are a lot of organizations working on family planning and reproductive health issues, having conducted various research and program activities, developing trainings and other manuals, and producing data, information, and communication campaigns related to family planning and reproductive health, but these resources are all scattered, often siloed within organizations and even teams or units within an organization, and they are not easily available most of the time, leading to the duplication of efforts and wasted times and resources. Our CAM innovation intends to address this challenge by developing an online platform that will host all the available information related to family planning and reproductive health from across the country, while meeting the need of finding the information in one place. Until today, there are no such platforms specifically designed for family planning and reproductive health in Nepal that provides contextual and organized access to information in a creative way. The platform will not only host the necessary information, but also provide a space for the professionals to connect and communicate with each other through online chat rooms, allowing them to learn from each other and also share about the ongoing family planning and reproductive health programming efforts. The platform also intends to offer an e-course for young people to orient them on family planning and reproductive health and help them to become future advocates and leaders in family planning. So it will be a one-stop solution to ensure learning from the past so that we can apply it to the present and future family planning and reproductive health programming. The innovation is anticipated to cost $50,000, where more than 90% of the amount will go to the direct cost for implementing the innovation, including the development of online platform and cost for the staff time to curate and moderate the content for it. The availability of updated and organized information in a single platform that is easily accessible to people of all genders without any barriers and limitations allows individuals and organizations to make informed decisions that will ensure more efficient and effective programming and use of time and resources. Like-minded organizations and family planning and reproductive health professionals will be reached out who are willing to share the information, and they will be invited to collaborate and will be trained on the importance of knowledge management, the website itself, and to update the available information on the website, which will ensure the availability of updated information even after the initial implementation period that will enhance the knowledge management. Last but not the least, our knowledge management innovation will ensure that Nepal can successfully reach beyond its FP 2020 commitment.
Wow, what a presentation. Let's go to the Q&A.
Hi, Shilpa. Can you tell us how you plan to market the website and the e-course that you will create? How will you advertise it to folks?
Initially, we are thinking like the Visible Impact is working as a youth focal point of FP 2020 in Nepal. So we are in the network of different organizations in the network, in the family planning committees and reproductive health committees. So we are planning to approach family planning organizations and individuals through that committee. And also as a youth focal point, we have now mapped the individuals and organizations who have been working on family planning, and we have mapped out, like for example, around 70 organizations who have been working. So that would be the starting point, and we are going to approach them either online or offline through our networks, and initially we will share them about our innovation and how this is going to impact our family planning goals as a whole. So that would be the initial point, and after we have completed some sort of a website preparation thing, we are planning to have a training, a large scale training with the family planning professionals, and where we will be making them realize that the knowledge management is our responsibility if we want to achieve the family planning goals. And also we will be training them about the updating, how they can update the information in the website once the website has began to operate. And also about the marketing, we are thinking to collaborate with the government and other big organizations like UNFPA and other INGOs who have been working on family planning from the very beginning, to add the authenticity to the website so that people can start using as the information comes from the authentic sources like government and other organizations like UNFPA.
That was an impressive pitch, but will it be enough to convince our judges? Stay tuned as we're joined by our next semi-finalist.
Namaste, I'm Priti Chaudhary from Jhpiego, India, one of India's leading FP organization. I stand here today to ask you for $50,000 to fund FP Connect, an AI-based digital solution for FPRH knowledge management in India. Owen Arthur, the longest-serving Prime Minister of Barbados, once said, "Often we are too slow to recognize how much and in what ways we can assist each other through sharing expertise and knowledge." India, the largest democracy in the world, has numerous international and national organizations and associations that are working to improve access and quality of family planning services in the country. Despite that, I've always felt that getting the right information into the right hands at the right time is a challenge. So, what could be the main reason for that? Is it a lack of common platform for knowledge sharing and getting information, or a platform where everyone can interact with each other? Or is it just that we FP professionals don't approach each other for sharing information? Well, I would say it's a mix of all of these reasons. Even today, when we all seem to be so well connected by technology, we are still unaware of what the other organizations or professionals are doing. Now, just imagine bringing everyone on a common platform. We at Jhpiego India are proposing a well-managed, centralized knowledge management system where FPRH information can be collected, organized, and housed electronically and is made available to everyone. This FP Connect platform will be co-designed in discussion with FPRH professionals while ensuring diversity and equity. FP Connect will act as a community for the FPRH fraternity across India. The FP Connect would provide a unique space for its members to share experiences, coordinate activities, and discuss important developments in the sector. This platform would help its members to connect with other members, getting information on key events, browse photos and videos, or join various thematic groups to follow the subjects of particular interest. The latest FPRH jobs and opportunities from across the country will also be posted on this platform. There's lots of information available online, but don't you think that most of it is a bit scattered? FP Connect, with its inbuilt indexing system, will help address this issue by allowing users to narrow search results. We will measure the impact of a solution by number of members, visitors, queries raised, number of jobs posted, user engagement time, and number of downloads. So, for all of you to be part of this community and receive regular communication to the areas of your interest, all you need to do is just sign up for it. The $50,000 that I mentioned earlier would mainly be used for development and technical assistance for the FP Connect platform. FP Connect will be developed and launched during the 5-month project period, post which Jhpiego will sustain this innovation on its own. And subsequently, we will explore integrating it within existing coalition, such as Advocating Reproductive Choice or Asia Region FP 2030 Secretariat. This integration will further help in wider participation beyond India, as well as sustainability. So judges, let me just say this one more time. Hoarding knowledge ultimately erodes your power. If you know something very important, then let's share it with each other. FP Connect is going to do exactly that in India. And this is why you should definitely fund it. Thank you. Dhanyavad.
Excellent job. Time for the Q&A. Judges?
Thank you, Priti. Thanks for that pitch. Just a clarification. Could you tell us more a little bit about the artificial intelligence component of the platform and how you anticipate that element to be carried forward? Did you say that Jhpiego will take on such components after 5 months? Because of course, there will be sustainability components for especially the AI components. Thank you.
Thank you, Clyde. This artificial intelligence will be developed when we are doing the development process for this platform. So we have thought of 3 main components area where this artificial intelligence will be linked. One is the AI-powered search engine, because as we see that when I was going through various documents and when I was reading interviews on these knowledge access and all, so what I came across is that we all feel that too much of information sometimes gets difficult. So these AI-powered search engine will simplify the user research, and this will help so that easily the user can find what they want. Apart from that, there will be AI live dashboards will be developed. AI will be collecting information on users so that customized experience for users can be created. And apart from that, what we are planning to do is creating the AI-based chatbot. It's kind of one thing which will pop up. The moment you log into this platform, a chatbot will pop up and you can ask your questions. Coming to sustainability part, Jhpiego India for us, KM is actually very important, and we have recently, while working on various programs, we have realized the importance of it, and it is a very important part of our Jhpiego globally, the policy. We have developed an action plan framework recently for that, and this is a need. It's actually, we have lots of momentum going on in Jhpiego for that. So it's what we also want, and somehow this thing is coinciding together, and we'll be using our resources because we have KM resources, people who are working in KM platform within Jhpiego. So it will be easy for us to sustain it using those resources.
Just one quick question, Priti. Who is actually your target audience in terms of gender and age group?
So when we were thinking of this target group, so we are targeting all the FPRH professionals in the country, starting from the field to the policy makers, because we have always felt that when we talk about the technical advisors, program managers, policymakers, they do get opportunity to interact. But somewhere the voices from the field, the people who are actually working in the field, their best practices are somewhere getting delayed. They are not able to bring their own learnings to us. So we want to eradicate that barrier and bring their voices here. And all gender, everyone. So whoever is working in FPRH field is welcome to join this platform.
Great points in that pitch, but were our judges impressed? We'll find out soon. Let's see what our next semi-finalist has in store.
Greetings from PSI India and good morning everyone. My parents always wanted me to have good education. It was their top priority. But was it my priority? No. Mine was to have fun. Prioritization happens at various levels as it is informed by different motives. Let us relate this to health. The world faced cholera and smallpox, but they were eradicated as they became priorities. Today, the world faces COVID-19 and it is everybody's priority to deal with it. The Indian government has done commendable work to meet the health needs of its rising population. The National Health Mission was born out of this need. The mission defined review meetings at various levels of the health system to address health priorities. But what is currently missing is the voice of those working on the front lines in delivering health. For example, accredited social work activists or ASHAs definitely know the number of immunizations remaining in her area, but does she know the number of family planning clients in her area? Does she know the denominator? Perhaps not. Similarly, there are challenges at other levels, but there is no mechanism to identify such challenges and direct them to decision-making authorities. Thus, it is time to channel the real health needs of the community and base decisions on them. Before I go further, let me introduce myself. I am Deepti Mathur, Senior Specialist for Knowledge Management at PSI India. PSI India has a strong footprint across the country and is a trusted partner of government. We propose empowering government at various levels to conduct an annual pause and reflect exercise as a mechanism where participants can have candid conversations, as to what is working and what is not, and identify learnings to inform programmatic decisions. The innovation provides a mechanism to gather implementation insights, curate, and effectively channel them to decision-making authorities within the public health sector. It will be modeled in one city of Uttar Pradesh after securing buy-in of National Health Mission at the state and city level. A cohort of master trainers comprising of government officials will be coached by PSI on the pause and reflect methodology via classroom and an experiential pause and reflect session interface with technology. This will elicit reflections on state and city level issues such as the effectiveness of a particular family planning intervention or scheme of the government. With master trainers on board, a cascade of pause and reflect exercise will start from the bottom of the health pyramid. Master trainers with PSI will facilitate a pause and reflect with a sample of ASHAs who are community health volunteers responsible for a catchment population of 1,000 to 2,500 people. ASHAs with access to smartphones will be selected to allow them to provide feedback anonymously on issues such as whether or not service delivery points are optimally located and what are the most pressing family planning needs of the populations they serve. Then, master trainers will conduct a pause and reflect exercise at the Urban Primary Health Center or UPHC level, which caters to a population of 50,000 people. This pause and reflect will include medical officers in charge who will reflect upon issues like the quality of family planning service delivery at the UPHC and are there any changes required to improve perceived patient satisfaction? PSI, along with the master trainers, will aggregate reflections from each pause and reflect and present these insights to the Chief Medical Officer, who is responsible for overseeing the entire health portfolio of the district, for probable inclusion in government work plans and budgets. In addition, some of the immediate top priorities from each level will also be shared with the respective supervisory levels for inclusion in work plans at their level. Thus, with state buy-in, this knowledge management innovation will be implemented at the city level by government master trainers who can easily replicate the exercise in the future as well as expand to additional cities. We are requesting $33,000, which will cover the cost for staff time and meetings at state and city levels, training meetings with master trainers, and 4 pause and reflect sessions. It must be noted that such a knowledge management practice has never ever been tested or even tried within the government sector or with frontline workers who are the direct interface between community and health services. This exercise has the potential to revolutionize the way prioritization is done and policies and government implementation plans are made. Therefore, let us elevate the value of the first-hand experience of ASHAs and UPHC staff who directly support the family planning needs of Indian communities so that we can better serve women with unmet need. The collection of insights from these positive reflect sessions must begin, and we are asking for $33,000 to make it happen. Thank you so much.
Nice work. Hey, judges, do you have any questions for this semi-finalist?
Thank you for that great presentation, Deepti. I really appreciated that you're using a single approach, pause and reflect, and thinking about how it can cascade through the health system. One of my questions for you is that in the pause and reflect, we like to talk about what works and what didn't work. And sometimes that can bring up sensitive issues or even some issues of power within a health system. So my question is, how will you work with the ASHAs and those operating at the urban primary health centers so that they'll be comfortable discussing these topics? How can you build safety and trust to discuss difficult topics? Thank you.
Thank you. Thank you so much for this question. It's a great question. Keeping this in mind that the government works in a hierarchy, and especially ASHAs who are women for the community who are who may become uncomfortable talking in front of the seniors. So we propose that we will utilize technology. So and we have mentioned that ASHAs with smartphones will be involved so that they are able to poll discreetly over some question that we'll pose to them, whether something like whether a nearest primary health center is is optimally located, or whether the clients needs are met, the perceived needs are met or not. So it'll be the technology will provide those options. Similarly, at the medical officer or the urban primary health center level also, we'll utilize technology. They will have options to share their views discreetly, and yet be able to have candid participation in this.
Deepti, it's quite interesting, but I'm not very clear when you said that it's empowering the government. So your master trainer will be government officials, and at the same time they will train the ASHAs or the volunteers, cadres, right? In your observation so far, do you think that the two are really working along well so far?
Thank you very much for your question. The idea to involve government is that this if this is to sustain within the government, then it has to have buy-in from the state and center. And if this is to sustain, then it should begin with government officials. So the idea is that we will coach, identify master coaches with the joint participation of the government, and coach them on this methodology via classroom and experiential pause and reflect, where they experience how reflections are elicited, where the participants are made comfortable, so that reflections are available and available for further use for decision making. And in my experience, and Mukesh can add, in my experience, so we propose that of the master coaches, especially at the ASHA level, we will involve people at the urban health coordinator level and community process manager. Community process manager is a person in the government who is who's mandated, whose role is to give guidance and direction to the community health workers. So if reflections are coming from this level to the person whose role would help from the insights, so this would actually help the person who's it will help the community health worker perform his role better. And so we propose that while doing pause and reflect, so master coaches will not train ASHAs, they will facilitate pause and reflect with ASHAs, with a sample of ASHAs. And this from the master coaches, one of the master coaches must be an urban health coordinator or a community process manager who is more aware and connected with the community health workers or ASHAs.
The competition is heating up. Who will be one of our CAM champion innovators? Only one pitch remains.
Hi, I'm Mehreen Shahid, based out of Lahore, Pakistan, and I'm representing the Safe Delivery Safe Mother NGO. Pakistan loses 14,000 women during childbirth every year, which is one death every 37 minutes, according to UNFPA. Alongside an appalling maternal mortality rate, this number also highlights that we are one of the most populous countries of the world with the highest fertility rate in the South Asian region. These numbers are not reported at a district level, which is critical to acquire insights on population growth, deliveries, uptake of skilled care and family planning services. This is especially needed in rural areas where over 60% of the population resides and does not have access to or opts out of skilled maternal and reproductive health care. Through my work, I have seen countless women impacted adversely due to socioeconomic factors such as not being allowed to leave their homes, lack of financial resources, beliefs against family planning, and long distances from healthcare facilities. Many of them lose their lives due to these life threatening delays. So, we at Safe Delivery, Safe Mother are working to create and report maternal health and family planning indicators which will most directly address community level needs that vary within and across districts. We first launched our unique mobile app to collect real time maternal health data at the district level in Lahore, which has a population of over 10 million. The data is acquired monthly from government deployed community birth attendants on pregnancies, deliveries, referrals, and more, with a cohort uptake of 80%. At the back end, we rigorously monitor data and conduct field visits to ensure accuracy and completeness. We are requesting $49,900 to expand our app to monitor and track postpartum family planning services provided by community birth attendants, as well as expand our geographic coverage of the app to 4 additional high priority districts of the Punjab province. The primary costs will be app development on data collection, verification, and validation for postpartum family planning with a target of over 80% cohort uptake. Our second bucket of costs include training government deployed birth attendants in Punjab on effective use of the app and the provision of postpartum family planning services. These two cost components combined will use up to 70% of the requested budget. Through our innovation, we will provide open source data with standardized metrics on key maternal and reproductive health indicators at the district level, along with indicators on socioeconomic factors that adversely affect women's uptake of postpartum family planning. We will conduct facility-based trainings for government-deployed birth attendants on providing postpartum family planning services and how to report on postpartum family planning data, along with other maternal health indicators on our app. Our innovation targets women and their families when they are the most accessible and willing to listen during antenatal checkups, and prepares them to choose a contraceptive option after delivery to reduce unintended pregnancies and unsafe abortions. Currently, birth attendants are not trained to provide and report real-time uptake of family planning services at primary health facilities in Punjab. Our innovation will change that. Birth attendants are the first and oftentimes only point of access for skilled care, with strong local ties and the highest outreach and coverage, especially in low resource, challenging, and remote environments. Our app is unique as it is designed in the Urdu language, is easy to use, versatile, and concise, taking birth attendants only 15 minutes on average each month to enter data through Android phones and connectivity provided by the government. Our monitoring data has shown the impact we can achieve from deploying skilled frontline birth attendants in communities. Each birth attendant conducts 30 to 50 monthly deliveries on average. We have trained 700 birth attendants in Lahore, Sheikhupura, and Gilgit-Baltistan area to date, who are positively impacting over 250,000 annual deliveries. These trained birth attendants, along with those that will be trained in Punjab with this funding, will be able to better serve their communities by providing them with postpartum family planning services. Imagine the scope of impact considering that 3 million of the 5 million annual deliveries take place in Punjab. To ensure sustainability, we will integrate our indicators into the reporting platform of the Maternal and Child Health Department, the IRMNCH of Punjab, which currently doesn't include postpartum family planning services. Through our app, we hope to demonstrate to the government how postpartum family planning data can be made more accessible and available for all stakeholders. This will create local ownership and will achieve scalability across 36 districts of the Punjab province. Thank you.
Thank you for a great pitch. Time for our final Q&A. Over to you, judges.
Thanks. What percent of births are delivered by your birth attendants?
44% of deliveries take place in the public sector. This is data by the department, and out of that, we have about 60 to 70% are taking place at the primary level. So essentially, those are the birth attendants that we're looking at. But then, of course, at the community level, there are a lot of synergies with private service providers as well. So by that, I mean our birth attendants will sometimes be referring patients to the private hospitals as per patient requests and requirements. So it is quite deeply integrated. But needless to say, the bulk of deliveries do take place at the primary level.
Great. And this kind of mobile information system you're proposing, to what extent does it link up and is it interoperable with the broader data system?
The IRMNCH essentially are the ones who we closely work with, and they currently have 4 specific vertical MIS systems, which they are currently looking to integrate. So that's their top priority. So we will basically be working with them and integrating these indicators into their platform, because currently they are not taking postpartum family planning indicators on any digital app. There's some 2 to 3 basic ones reported on a paper-based app, which takes a long time for them to read. So we will be integrating into that, and that is then going to be rolled across out in Punjab. So the benefit of that is not only collaboration and synergies directly with the government, but we're also going to be supporting and helping them in how they can integrate all of their vertical platforms, how we can ensure quality data at the back end, because with this innovation, we also want to train the government staff at the back end that's receiving data and what they're able to do with it, in addition to their own system.
Building on what you just said, to what extent are you confident that if it's successful in Punjab,
Yes.
Yes, the government at the central level will take it on to scale, the scalability. Thank you.
A host of factors, because we're currently in conversation with IRMNCH and we talk about it. Punjab is the most populous province. It's the province which has the most resources, and it's got connectivity, which other provinces are not so good at this point. So with a 110 million population, this is where 60 to 65% deliveries take place. Once you're able to scale a project at 36 districts of the Punjab province, there's really nothing, no other province that matches it in scale, also in size. So if you're able to show it in Punjab, the federal government will more than happily take that on board. But I would also like to highlight to you that in Pakistan, the 18th Amendment has devolved healthcare, education, and these services at the provincial level. So essentially, these decisions are made at the province, which if Punjab chooses to do something, Sindh may or may not choose to. It is their prerogative. So it is also important to highlight the context and how Punjab becomes very important. And the good thing about this is there's a lot of provincial synergies then. When, for example, other provinces see Punjab shining and doing well, which has happened in polio, it has happened in immunization work that I've participated in, also in maternal mortality, then other provinces are quick to take that on board as well.
Thank you to all of the semi-finalists for sharing their exciting knowledge management innovations. It's clear that any one of these ideas would help to improve family planning and adolescent and youth sexual and reproductive health programming. The judges now have a hard decision to make. Which 2 should be funded? I'd like to ask our esteemed judge, Tara Sullivan, to share with us what the panel of judges have decided. Who are the 2 winners?
I'm pleased to announce the winners of the pitch competition in Asia. But before I get to the winners, I do want to say that it was a very stiff competition. The semifinalists for the Asia pitch were all very strong with innovative solutions for pressing knowledge management for family planning and reproductive health problems. With that said, it gives me great pleasure to announce the 2 winners of the competition in Asia. Our first winner, hands down, was Safe Delivery, Safe Mother, Pakistan. This innovation will be working to report maternal health and family planning indicators. They will specifically be using an app to monitor and track postpartum family planning services provided by community birth attendants. As part of doing this, they will be expanding their coverage and will be working in a number of high priority districts in the Punjab province. The judges were really pleased with the great need that this satisfies in terms of birth attendants being able to report up, postpartum family planning. The judges were also really pleased with the sustainability aspects of this pitch, in which it will be working with existing health cadre, it will be expanding on an existing app, it will be delivered in the local language, and the numbers will be fed into the maternal child health department. So we're really pleased with the amount of local ownership and the ability for this to sustain itself beyond the 5 months of the project.
I'm super excited, right? Because as I mentioned, like this is my life's work. This is my passion. This is where I am, right back, like my hand on the pulse. We're working with government. We're working with local NGOs. We're working with partners. We know exactly what's needed on the ground. We know what the next step is, what's the next requirement is. So from that perspective, this grant and the fact that it comes at this time is absolutely amazing for us, right? And to be able to participate simply because of the urgency and the need. Because even if we compare ourselves in the South Asian region, we've still got the worst statistics on maternal mortality and population growth. So from that perspective, I think this would be huge for us, for me, for our NGO, and of course for the implications it has for the community.
I'm pleased to announce that our second winner is Jhpiego, India, with the innovation FP Connect, which is an AI-based digital solution for family planning, reproductive health knowledge management in India, and it will provide a centralized knowledge management system where FPRH information can be collected, organized, and housed electronically and thus available for everyone. Similarly, the judges were really pleased with the innovation of this in terms of that FP Connect will be using an AI-based system, and also we're pleased with the sustainability aspects of this innovation in that Jhpiego, which has strong knowledge management qualifications, will be able to sustain this innovation and will seek to integrate with other existing coalitions such as Advocating Reproductive Choice and the Asia Region Family Planning 2030 Secretariat.
Personally, it would mean a lot because I'll be leading this whole activity and I'll be able to put up my ideas, which I have so many ideas how to implement it, how to bring everyone together. And I come from a different public health sector. This family planning is a bit new to me. And there we had lots of knowledge management things happening. So bringing all that knowledge and experiences I have from my previous sector to bring here, I think that's like a new challenge for me, and I'm sure I'm going to excel that.
Once again, we'd like to express our deepest gratitude to all the semi-finalists for the effort that they have put forward in developing their pitches. All of the innovation shared today can be found on the Knowledge Success website at knowledgesuccess.org. We'd also like to thank our judges for their thoughtful deliberation and time today. We know that we did not ask them to make an easy decision. Finally, our sincerest thanks to you, semi-finalists, judges, and our listeners for your continued dedication to family planning and reproductive health. You are making a difference.